Welcome to this first program in a series reviewing the science and management of common pain. This series is designed with a layperson in mind so that information is imparted that will help others find relief from pain. To begin, it's important that we have a common understanding of what pain is. It may surprise you to know that medical science says that pain is actually a perception, a combination of electrical and chemical events in the central nervous system that are interpreted by the brain as pain. This is critical because the science and treatment of pain cannot be appreciated or fully understood without this fundamental and basic understanding of the mechanisms of pain signal generation, transmission, and interpretation. In this program, we will investigate how pain is perceived by the brain, how the treatment works to interrupt pain signals, and finally, how the consumer can become empowered to help manage their own pain. There are two sides to pain, good and bad. Before you jump to conclusions, think about this. Without the pain mechanism triggered in the body, you could not remove yourself from danger. So the actual presence of acute pain is good. Acute pain is defined by the medical community as a sharp but brief pain, and it is the only signal the body receives when harmed. It is also the pain you feel after an injury or an illness while the body is healing. But obviously the bad part about pain is it hurts. The only thing that could be worse is pain that will not go away, pain that continues for months or that comes and goes, like the pain from an old sports injury is called chronic pain. Treatment of pain costs this country alone $4 billion in medications and alternative treatments, and close to 30 million lost work days on the job among all its working citizens. If you suffer from chronic pain, no one has to tell you that everything about it is bad. What we will discover in our program today is how the electrical properties of nerve cells can cause faulty pain signals. Let's begin with the basics of the pain signal and its receptors in the body. Your body has an incredibly intricate computer system called the brain. It has a network of fibers that run throughout the body to convey information back and forth, just like the phone wires in your house convey information over the internet. That is an oversimplification of your doctor's knowledge of the body, but for our purposes, it is enough to help you understand pain and how it may be relieved. The central nervous system includes the brain and the spinal cord. These structures process incoming sensory information, making mind-body decisions and sending messages to various muscles to react accordingly. The peripheral nervous system is a subsystem that connects the spinal cord to all extremities of the body. The peripheral system works through two processes. There is a motor impulse that, for example, allows you to pull your hand away from a hot stove. And there is a sensory impulse to handle all the stimulation being sent to the brain, such as feeling the hot stove. The sensory impulse has special receptors in the eye, on the tongue, inside your ears, and other places that bring awareness of balance, pressure, odor, taste, sight, sound, and pain. The autonomic nervous system is yet another subsystem and is broken down into two parts, the sympathetic and parasympathetic systems. In general terms, and to simplify the details of its inner workings, the autonomic nervous system can be thought of as automatic. It regulates breathing, heartbeat, blood flow, digestion, and activities of the spleen and kidney. Activities you do not think about or try to control on your own. The autonomic nervous system is also thought to play a role in the sensitivity of pain fibers. The sympathetic nervous system is the emergency system that is activated whenever a person gets excited or frightened. It is what makes the heart beat faster, makes the pupils open wider, speeds breathing, activates sweat glands, and routes more blood to muscles and the brain. If you are in danger or at a sporting event, then all of these nerves work together. And it is the sympathetic nervous system that is believed to play a greater role in the experiencing of pain. But the parasympathetic nervous system is just the opposite. Its job is to settle the body down to its normal levels after the danger is gone or the event is over. Both of these components work together to keep the body working like a fine-tuned engine and always ready to react when needed and return to normal when necessary. However, it is unclear as to the role the parasympathetic system plays in pain mechanisms. Still, this overview will lead us to an understanding of pain and its relief. Should the sympathetic nervous system be stimulated for prolonged periods of time, the body simply begins to ignore the impulses it receives and adapts. The body appears to be reacting normal, and yet the pain may still be present. Consequently, some patients continue to experience pain, though there are no visible signs of sympathetic nervous system stimulation. Their bodies have adapted to the pain impulses. It is this situation which often misleads doctors who are attempting to diagnose their patients who come to them because of pain. If you've ever heard a doctor say that the pain you feel is all in your head, well, in one distinct manner, he is exactly right. The pain perceived by your brain is real, but what causes it may not be obvious. To explain how pain is perceived, we must first explore some basic science regarding nerve cells. The nerve cell is a complicated and marvelous creation. Looking at this cross-section illustration, it may look more like a blood vessel, but it can be made clearer by thinking of it as something like a battery, with a series of small gates or valves all around its surface. It can be loosely called a battery because the nerve cell membrane contains polarity. A voltage difference can be measured across the nerve cell wall, just as it can be measured between the plus and minus poles of a battery. The voltage difference of the cell is caused by distribution of minerals with opposing charges. This distribution is maintained by specialized pump mechanisms in the cell wall. The fluid on the outside of the cell wall contains a predominance of sodium ions. The interior fluid contains sodium, but mostly a predominance of potassium. The outside layer is positively charged like the top side of a watch battery, and the interior surface of the membrane is negatively charged. This is the nerve cell's normal state until we are subject to some dangerous stimulation and pain impulses are fired. In this next illustration, we will diagram the changes that take place when that dangerous stimulation occurs. The kind that causes a pain response, such as getting stung by a bee or hitting your thumb with a hammer. A bee sting contains chemicals, and a hammer causes pressure changes, both of which send stimulations that activate pain receptors. These chemical and pressure stimulations cause the gates in the nerve cell to open. There are many types of gates that open during this process, but for simplicity, we will only address the opening of the sodium gate. Basically, receptor activation causes the magnetically influenced fibers of the sodium channel to change shape, which allows an opening for sodium to rush into the cell. This is what scientists refer to as leaking. This leaking of sodium into the cell membrane changes the voltage across the membrane surface. This voltage change causes the magnetically influenced fibers of nearby gates to also change shape and open. The voltage change spreads as more adjacent membranes open their gates, and it continues until the entire nerve cell has opened up all its gates in a sequence, like a set of falling dominoes. This continues along the nerve cell to the point where it connects to the spinal cord, where the message is sent to the brain. These pain receptor nerve cells can be several feet long, stretching, for example, from your big toe to your spinal cord. Consequently, the domino effect of opening gates travels from the point of stimulation all the way to the spinal cord. Once that pain signal travels the spinal cord to the brain, we know we have pain. We know where it is and how intense it is. We then immediately react to stop it, such as pulling your hand away from a hot pan or jerking your arm away from a thorny bush. The central nervous system has done its job, warning us of danger to the body. But what happens when the danger is over, the injury is gone, but the pain signal is stuck on the on position? Picture a smoke alarm going off to alert you of a fire. Well, after the fire is out, you don't want that loud, annoying sound to keep continuing. That is the picture of chronic pain. If you want to relieve pain, you need to plug the gates that leak. When the gates are closed, the pain signal does not travel up the nerve. Plugging the gates would be like hitting the reset button on the smoke alarm. Stop the firing of the pain impulses and the patient experiences relief. Currently, the consumer uses several methods for treating common pain, such as over-the-counter drugs, prescription drugs, physical therapy, and electrical stimulation, such as the TENS unit, which is available without a prescription. However, we do not know for sure how some of these products work. But for others, we believe they work by affecting the movement of ions across the nerve membrane, or in simpler terms, plugging a leaking gate. Armed with this knowledge about how pain works, Dr. Robert Holcomb of the Vanderbilt Medical School developed a new technology that stops the leaking gates through the application of a static magnetic field. In essence, Magna Bloc plugs a leaking gate that continues to leak with no apparent chemical or pressure changes. Dr. Holcomb utilized the knowledge of membrane polarity to create a device that would affect the magnetically influenced fibers in the channel gate itself. This is what the Magna Bloc technology is all about. With the specific design of Dr. Holcomb's device, using 4 small magnets in a quadrangle pattern, the proper magnetic field is created that manipulates the magnetically influenced fibers in the sodium gate to close itself up. It's like hitting the reset button on the smoke alarm, allowing the patient to experience relief. It is important to state, and we cannot state this enough, that Magna Bloc does not interrupt normal nerve cell operation to warn the body about potential harm. What it does do is reduce the pain signals being sent. Magna Bloc focuses a magnetic field directly to the point where leaky gates occur. Therefore, Magna Bloc has offerings to many patients, including some who have not found relief from pain with other alternative treatments. Of course, any overview of this type must never be used in place of a medical consultation with your preferred physician. Pain can be attributed to a variety of factors, and only with proper professional consultation can the cause of an individual's pain be properly diagnosed and treated. Treating the whole patient may be necessary, and that may involve addressing the diet, mental state, a complete medical history, and high-tech testing in some cases. However, Magna Bloc can be used for relief of common aches and pains associated with everyday activity. Magna Bloc has no side effects and does not require a prescription. It can be purchased and used in the privacy of your own home. Magna Bloc applications have become distinct and effective when tested by Dr. Holcomb and his staff. And it is the wish of Dr. Holcomb to make sure that Magna Bloc is applied effectively with every use.
When properly applied, these devices really work. And the reason the device was developed initially was because throughout medical history we have attempted to treat pain frequently by inflicting pain first. And in particular in children, I thought that was a real bad way to practice. So I attempted to build a device, and did build a device in which I could treat children for pain without first inflicting pain. And that was the original stimulus to develop the device. But since it was developed for children, a whole array of painful conditions have been successfully treated, and it has significant potential for impacting the pain, particularly common aches and pains of the general population of the world.
Magna Bloc is a simple-looking disc with simple application maneuvers. However, placement is important for full effect, and following the guidelines put forth in this videotape will greatly enhance your effectiveness at home with common pains. Magna Bloc is applied with double-stick adhesive patches that topically apply the unit to the skin. As we review the applications, always be mindful of where the orientation mark on each Magna Bloc disc is located, as it should always point upwards in relation to the body. Always make sure the skin is clean. Apply Skin Prep, a solution commonly used in hospitals, or some other sort of barrier product, to avoid irritation from the adhesive used at the site where Magna Bloc will be applied. The following are examples of pains that may be relieved with Magna Bloc. These are 4 common pain problems which many of us have experienced in our lives. Headache is a common complaint, and there are many varieties. Without going into all the details of each kind, Every headache, regardless of the cause, has a final common pain pathway. The pathway is the stimulation of pain-sensing fibers. For a frontal pain type of headache, the discs are placed at the front of the head over the pain. If the pain involves the entire front of the head, then the disc may be placed over both temples. A third Magna Bloc is placed on the forehead above the brow line if pain persists. Many headaches start with prolonged neck pain and tension. Procedures for relieving these pains are the same as treating our next category, neck pain. Remember, neck pain and headaches can be symptoms of serious medical conditions. If you suspect that you have a medical problem, or if you have symptoms other than pain, or if your pain persists, then you should see your physician. Always follow your physician's advice. Neck pain may have many underlying causes. However, most neck pains may be relieved with 3 or 4 Magna Blocs. 3 discs in a pattern like this may be used for headaches. 3 and 4 discs may be used for more serious pain. Using 4 discs, the array begins with placing the first Magna Bloc in the midline about 2 inches above the bulge at the base of your neck. The second disc is placed over the midline about 1 inch below this point. The third disc is placed approximately 1.5 inches to the right of this point. And the fourth disc is placed approximately 1.5 inches to the left of this point. For a 3-device array, simply remove the bottom disc. Low back pain is the most frequent cause of pain and disability. A specific structural abnormality cannot be demonstrated in many cases of low back pain. Therefore, the cause of such pain can be difficult to diagnose and treat. However, low back pain of many different etiologies will respond to the Magna Bloc disc. The first disc is placed at the base of the spine just above the cleavage in the buttocks. The second and third are placed over the dimples on either side of the spine, just over the buttocks. The fourth disc is placed midline on the spine. To find this placement, draw a line between the highest portion of each hip bone and place the disc where the line crosses the midline on the back on the spine. The fifth disc is placed in the midline approximately 2 inches above the fourth disc. There are many causes of wrist pain, which can be relieved by using the Magna Bloc disc over the wrist, centered midline where the midline intersects with the first wrist fold. As always, if pain persists after using the Magna Bloc disc, consult your physician. Once the Magna Bloc discs are applied, follow these simple directions for comfort and effectiveness. Always keep the orientation mark on the disc pointing upwards, and always leave at least 3/4 of an inch of space between each Magna Bloc disc. Keep the skin marked around the Magna Bloc disc with a permanent marker. Change the double stick adhesive every 2 to 3 days to prevent skin irritation, or more frequently as needed. Clean your skin well after removal of the disc. Water will not damage the disc, so bathing does not require removal. Use vitamin E oils for any irritation caused by the adhesives and apply skin prep or some other barrier product to avoid irritation at the site. Damage to the Magna Bloc disc may occur from prolonged exposure to heat, as inside a closed car. Avoid hitting the disc or dropping them, as this may chip the magnets and ruin the magnetic field and its effectiveness. The disc should never be worn near a pacemaker, dorsal column stimulator, implanted infusion pump, defibrillator, or any other magnetically programmable medical device. Also, do not place the disc near credit cards, videotapes, computers, or computer disk, as this may adversely affect them. Magna Bloc has not been tested on pregnant women and should not be used during pregnancy. Magna Bloc. It's not a cure-all, but provides a real benefit to those who suffer from pain. As more research is conducted and the principles of biomagnetic research continue to evolve, you can be assured that the Vanderbilt School of Nursing and Dr. Robert Holcomb will be quick and efficient in their notification of new breakthroughs and applications. This series will constantly update the knowledge that best helps you in improving the quality of your life. It is our hope that this overview will benefit your understanding of pain and your options for treating the common pains of daily living.